So today I will be treating my stretch marks. These stretch marks are about 8 years old and they're located on just above my upper hips on both sides. We'll be microneedling them today. So if you want to see how I go about doing this, keep watching. So to get started, I'm gonna need my pen. So I have the dot pen. I think this is the M8. I have my needle. So as you can see, still in the packet, and this is the 11 pin needle. And then we have some alcohol wipes to wipe the areas being treated, because you have to make sure that the area is aseptic before you do your treatment. And then we will get started. Okay, so what we're going to do is we're going to set up the pan with the cartridge. So we're going to take the cartridge from the packet. And we're going to keep the tip on here just to keep the needle sterile until we're ready to use it. So we take the cartridge and we insert it in the pen. And we make sure that is secure. So I won't be putting any topical anesthetic on the area. I'm just gonna treat it as is. I'm gonna treat with at 0.5 and because it's a scar. With scars you tend to go a little bit deeper when you're microneedling if you're treating scars. So because we're treating stretch marks today, we can go a little deeper. Now if you're in a clinic, you would be consulted by your clinician and they will treat accordingly. Make sure that you wear loose, comfortable clothing. You do not want anything too tight rubbing on the area after you've treated it, or you don't want any dirt or anything to get to the area. So loose and comfortable clothing when you go to a clinic to have your treatment done. Even if you're doing it at home like myself, you wear loose, comfortable clothing and make sure that the area can breathe. Okay, so when you set your pens, you have your settings here. So all the numbers, you have 0.5, 0.75, 0.25 here. You make sure that the arrow is pointing where you want your setting. So I'm going to start with 0.5. I don't mind starting with 0.5. And if need to, if I'm not getting like any pinpoint bleeding, then I probably might go up to 0.75 or 1. But let's start with 0.5 and see where we get to. Okay, so I'm going to start by using my alcohol wipes just to cleanse the area. So we clean everywhere that we're going to treat. And so we take the tip of the pen. I'm going to go up to 6 speed at 0.5. And we start by stretching the skin just a little bit in both directions and we get started. So you can feel the pinprick, but it's not uncomfortable at all. Okay, so what I forgot to say is I've added some serum. So all I did was added some hyaluronic serum from Medicaid, the B5 serum. I just add more so for the glide of the pen than anything else. So at 0.5, it's not that painful. You are feeling the little pricks, but it's not that painful. So I'm concentrating on one stretch mark at a time before I move on to the next one, and I will continue that process until I've treated all stretch marks. So as we can see, there's no bleeding, and I'm stretching the skin just to make sure that the needles get into all of these areas. So there's no, again, bleeding, so I might just go up to 1 just to get that pinpoint bleeding. Normally with scars, you tend to stamp to treat, depending on scars. But these are stretch marks, so I'm walking along in circles around each stretch mark just to make sure that each stretch mark is I'm gonna go up to 1. Now you can, if you want to, put anesthetic on the area to make it more comfortable for you, but I'm not gonna put any numbing cream. I'm just gonna treat as is. Ideally, you're not supposed to be putting anesthetic if you're not in a clinic, or if your insurance covers it, it's fine. But as you can see, there's not really any bleeding, and I'm up to 1. But I am concentrating on each stretch mark. Okay, so I've gone on over and I've started the other side. Again, I'm treating at 1, but still no pinpoint bleeding, focusing on each individual stretch mark. So I'm just running the needle slowly over them, back and forth. I must say, it's not the most comfortable treatment without anesthetic. There is erythema, but no pinpoint bleeding. We're trying to achieve at least some pinpoint bleeding. What we're doing with stretch marks, with any other scars, is to break down that scar tissue. And once the areas start healing, it will start producing more collagen and elastin, and that will start evening out the skin. So the more sessions you have, 4 to 6 weeks apart, the more results you will see. You just need to know that one session, while you will just see results from one session, you won't see optimal results, and the stretch marks won't disappear after one session. Okay, so here I've gone on to the other side, and this is what it looks like so far. I am still treating on 1. No pinpoint bleeding just yet, which is weird, but I'm not worried. There is erythema. What we're trying to do with these stretch marks, or with any other scars when treating them, is to break down the scar tissue. Once you've broken down the scar tissue and the areas start healing, then you will have your production of elastin and collagen. So this I'll be doing every 4 weeks. You can do them 4 to 6 weeks. How many sessions you require depending on how old your scars are. My scars are about 8 years old. My oldest child is 8 years old, and I've got 2 children. So it depends on how old your scars are. That depends on how many sessions you need. You will need anything minimum 4 sessions. If scars are fresher, 1 year, 2 years, then they will need probably 4 to 6. But all the sessions might need 6 to 8. It just depends on how quickly they're broken down, how you're reacting to the treatment and the progress. So how many sessions you need would depend. So what I'll be doing with my sessions, I'll be taking before images. I'll be seeing what it looks like a week later, and then 4 weeks later before I do the second session. I probably might put numbing cream on the next session because this is pretty uncomfortable, and we're treating at 1, and it's a very sensitive area as well. So I probably might numb and go to 2 on the next session, but let's see how this one goes, and then depending on this one, I will treat accordingly for the other sessions. So I've done one side, and this is the second side I'm doing. Focusing again on each individual stretch mark. I mean, if you're doing the full tummy, you probably might want to make it comfortable and put topical anesthetic on, because doing this small area is not the most comfortable. And with scars, you want to go as deep as possible to make sure that you've broken down each scar tissue. Make sure that you get it as deep as possible so the results will be awesome. Now, I'm not going to go up to 2 just because I don't have any anesthetic and it's not the most comfortable treatment at 1 as is already. And yes, my pain threshold is not the best. But let's not get into that. So we see that we've achieved erythema on this area. No pinpoint bleeding, but we've achieved erythema. I will put some photos of what the area looks like post-treatment so you can see close up, because I don't think my lighting is the best. And because of my skin tone, you can't really see what I'm saying. Okay, so I think that's it for now. So what I'm going to do is I'm going to cleanse the area, remove the excess serum from here. And again, with microneedling, there'll be some swelling in the area due to the needling. But yeah, that's what it looks like immediately after. I will put some images up. You can just about see how dark in that area has gotten to compared to here. So I actually went in and tried 2. But when you're trying to, I think when you get to 2, it's more of a stamping as opposed to gliding it over the scar, over the stretch mark. So I did 2 and I did a bit of stamping, but still no bleeding. Still no bleeding. I will see you shortly. Okay, so completed both sides, treated one side. I did go up to 2 on one side as mentioned earlier in the video, just to see how I'll tolerate it, and it was a no-no. I think it was more stamping as opposed to gliding over the area, because you have to focus because the needles are going a bit deeper and it stuck a little bit out from the cartridge. So we can see when we go up to 2, the needle goes deeper into the skin. So I'll try it with 2 on my next session, but I will apply some local anesthetic, some topical anesthetic, just to make it that bit more comfortable. But right now, what you'll feel post-treatment is a burning sensation. So the area feels like it's on fire. But that's normal. So your aftercare for these areas, depending on which area where you're treating, would be to apply moisturizer, not within the first 24 hours. The first 24 hours you do nothing with the skin, because you just open up the channels and you don't want to make the area infected. So keep the area sterile and as clean as much as possible. This is where you wear loose clothing to, so over the next few days where you've treated, whether it be the face, arms. I've also got some stretch marks on this arm that I'm going to treat, but not today. These are a little finer than the ones on the sides of on my flanks, but I will treat these on another day, and that's for another video. So yes, what you want to do post-treatment is to wear loose clothing. If you did your treatment at the clinic, wear loose and comfortable clothing. Try not to put anything on the area. When you wash, try not to wash with hot water. Tepid water, a bit warm would be okay. Avoid any saunas, avoid any pools, any heated activities that will make the area sweat and heat up, because that will again increase infection. And just let it be for the next 24 to 48 hours. After that, the area is going to start feeling tight and dry. You can moisturize the area with some hyaluronic acid, which is what I use on the area, and that's it. Just keep it moisturized because it will be tight and uncomfortable. And that's all you need to do. Depending on which area you've treated with your scars, you can continue with your skincare routine if it's the face. With areas like this, you don't need to worry. If it's sunny where you are, once you've done it, you need to make sure that you apply SPF on areas treated as well, just to prevent post-treatment pigmentation, hyperpigmentation, and all that not so good stuff. Then that'd be another thing you want to treat. Okay, I will post an updated video with what this looks like a week after the first treatment. Then we'll do one 4 weeks later just before we do the second session. So you can do microneedling every 4 to 6 weeks, but with these ones I'm gonna see what I do every 4 weeks. I might treat every 4 weeks just to stick within that shorter period of time. What you want to do is allow the area to heal, allow your cells to turn over, allow the collagen production, and all that good stuff. What you can do, you can treat with PRP if you want to. I mean, it really doesn't make much of a difference. It's the microneedling is what's doing the job, what's breaking down the scars. So I will do an updated video. Any questions, please pop them in the comments below and I will respond to them. Whatever other treatments you want to see done with microneedling. I don't have any makeup on at the moment because I may or may not be doing my face. It is the weekend and I want to treat myself before a new work week. So I've done my scars. I might be doing my face, hence the reason why there's no makeup on. And I will see you in my next video. Until then, ta-ra!